Hi. Hello, everyone. Welcome to first PhenoLab meeting in 2026. We are very happy to have Carolyn Dower. Carolyn Greenwood Dower is a researcher at Durham University in the UK. Carolyn is a psychotherapist by training in integrative cognitive analytic therapy and Gestalt approaches. She is a former consultant psychotherapist in the NHS and the former head of counseling and mental health services at Durham University. Caroline has a private practice for therapy and supervision and is a lecturer at the Sherwood Psychotherapy Institute. Here, Caroline draws on clinical experience with young adults and her interest in movement as part of our sense making in this PhD research on anxiety. So today's talk is making sense of anxiety, developing awareness of movement to understand sense making and the habitual experience of anxiety, a presentation of conceptual and empirical world. Please welcome Carolyn with me. And stage is yours.
Thank you. Thank you so much for the introduction. Thank you, Francesca, for the invitation as well to present. So I'm really close to submitting my PhD thesis, so I'm super excited that someone's interested to hear something about it. It's an injection of enthusiasm as I head towards the final stages of this thesis. Um, and it's been a thesis that's been in the making now for about 5 years. I think I started it just as we were going into COVID. So 5 or 6 years, I've been running this part-time alongside my other roles. A moment then first on my motivation for this. And actually, I'll tell you where we'll go today. I'm going to set out first of all what really motivated my thesis and the psychotherapeutic and phenomenological influences on the work. I'll say something brief about the research question and my methods. What I really want to share with you is the findings on both anxiety and then how I've been pulling this together into an integrated model of sense making, building on some earlier work by Fuchs and Koch in this domain. And I'll draw out some implications. So we'll see how we go for time. When I get excited, I talk quite quickly. So if I'm talking too quickly, please do say and slow me down. I'm conscious for some of you, English will not be your first language. So if I'm going too quick, please do say. So my motivation then, so I've been a psychotherapist for 20, 25 years. My first job was with students at a university. I had many years in between where I was not in universities, and I moved back into the university sector about 10 years ago. I was really struck returning to work with young adults 10 years ago by the increased prevalence in anxiety. And I was particularly struck by the way that young people were talking about their anxiety, and this formulation, especially of I have anxiety. Anxiety as a disorder, as a label of themselves, was sort of present in a way it just had not been the case 10 years before. And this was pre-COVID. We've seen, if anything, a kind of, even more of a spike since. And this idea of I have anxiety, that just didn't make sense to me in the way that I would have conceptualized anxiety as being a way that we are in the world, a way of managing ourselves in the world, rather than some kind of I had this phrase I would often use with my university colleagues. I'd say, it's not diabetes. It's not an enduring condition. And of course, now actually we know that even type 1 diabetes doesn't need to be an enduring condition either. But I was particularly vexed by what was happening in the numbers of young people presenting for help, but even more concerned by the models that they were encountering when they were arriving at health services or university services, where in resource constrained environments, the tendency, of course, is always to do something quite quick, to offer people an explanation of what's happening to them. There's often a kind of pull towards something quite didactic and explanatory. And particularly in the health service in the UK, this may be the case for others of you in your own countries, a pull towards giving people workbooks so they can really kind of learn about themselves and kind of fill stuff in and respond in a very kind of impersonalized way, but also a way that is telling them about their experience. So I was troubled by this. It didn't make sense to me in the kind of environment that I was working in clinically. So let me say just a little bit of something about my background then as a clinician. So I trained in integrative psychotherapy, which has a deeply relational ontological position that we are formed in relationship. We are always being formed and reformed in the ways that we relate with our intimate others all the way through community and culture. And this idea of how we are doing this not only through the kind of the cognitive kind of ways of sense making that the models of anxiety seem to be emphasizing, but rather I see this as a much more fully embodied way of experiencing and being in the world that is always in process and always becoming. So, one of the trainings that I went on to do, because I was so interested in how we put a lot of emphasis on how we are formed in relationship, often in early years, and yet most of our psychotherapy models operate at the verbal domain, at the kind of the sense making at a verbal level. I was interested in how my patients seemed to move differently when they got better, and whether, in fact, there could be something really interesting about working with movement to understand and to work with habitual ways of experiencing ourselves in the world. Because fundamentally, I see psychotherapy as a process of clarifying and illuminating the habitual ways that we are experiencing the world. How is the way that we are making sense of our experience, making the navigation of all of the ordinary ups and downs of life, is that they're made more challenging because of our habitual ways. So I particularly then attend to movement. So I'm just going to move something for you, just to give you a little bit of a flavour of that. One of the theorists who's been most influential on my work is called Ruella Frank. She's a Gestalt psychotherapist working in New York, and she's developed a really interesting taxonomy of our patterns of movement, looking at how we are moving in relation to each other, as well as the floor, the chair, the world, the whole situation, and how we see the patterns that are going on the normal ways we talk about relating. They're always already there in our very patterns of moving and gesturing. So I'm just going to give you a little flavour of that. If I show you that I'm actually in my consulting room here. So if I angle that towards my chair, can we see my chair there? Let's see if I've got the angle right. Yeah, almost. Let me put that one up like that. So as a client comes into my consulting room, I'm interested already in how they are in the chair. It makes a big difference what impression they make on me if they sit in a relaxed and calm and easeful way, or if they are holding themselves with particular qualities, and I'm interested in how they are relating to the floor, the chair, and how they gesture moment by moment with me, intervention by intervention. So, as a young person, say if a young adult came to me and they said that they had anxiety, my first intervention would not be to ask them about what makes them anxious or anything about their anxious thoughts, but I would be looking very carefully at how anxiety lives. Um, this is here we are in PhenoLab. These a kind of deeply phenomenological intertwining of self and world will be a very familiar starting position to many of you. But here I want to show how it operates in an intervention. So as a client comes with anxiety, I would be looking at how their foot might be glancing at the floor rather than finding support from the floor. How have they, what, how might they be gathering themselves, holding themselves? What is that already saying to me about the world that they are living in? And as they organize themselves in this way, how does that already shape then how they experience me, because their experience of me will be really different if they sit in an anxious, gathered up, tight, tense. Perhaps they've gathered their abdomen, perhaps there's tightness across the chest, perhaps they pull their elbows in. That very way of organizing themselves will shape how I appear before them. And so, as a psychotherapist, I would be starting with my inquiry at that level about how they are anxious. And I would be gradually in the process of psychotherapy, where they're coming to me over a period of time, I would be drawing that into a deeper level of insight and connecting that with the way that they're relating to their spouse or their siblings or their manager, their course, their whole orientation towards the world. In this work, then, with young adults, if I draw this back, we had thousands, I mean, thousands of young adults presenting to the university service saying they had anxiety. And one of my first interventions when I started was to do a yoga therapy type intervention, trying to encourage them to feel their felt experience a bit more closely. That got us somewhere. I did a really interesting pilot project. But what became clearer to me within that is that actually what's much more interesting is for them to feel more deeply the experiences of their own movement in their own lives, rather than me facilitate them through some, um, what it is to have lovely warrior moments or Tadasana or these lovely shapings. They can build an embodied awareness through those interventions for sure. But what I wanted them was to really understand the subjectivity of their own experience. Because in this world where they seem to be objectifying themselves, and in this I have anxiety, it seemed crucial to see if we could find a way to reconnect them back to what their anxiety is actually doing. So I designed my thesis then on this basis. I'm going to see if I can share now just a few slides. I'm not going to share many slides, and I do want to move some of my findings for you rather than um, present it all in text form. So let me see if I can just share something here. There we are. That one there. Great. So you can now see my slides, can you?
Yes.
Have a yes. Great.
Yeah.
Okay, so that's where we were going.
Mhm.
Okay, so fundamentally, all of my clinical work and certainly the deeper conceptual work I've been doing within this thesis, the work of phenomenologists like Merleau-Ponty are so central to this and this deep intertwining of self and world, as I was just moving for you there. There's the way that the world comes to me, comes into me through my embodied experience, and my body is a very medium for then how the world shows up for me. So I became interested then. Here was my research question. How does the unfolding awareness of movement experiences in anxiety inform our understanding of sense making and the phenomenon of anxiety? So I really wanted to pivot away from this, what makes you anxious, and the kind of content of this idea that as if anxiety is this inner thing, as it is in the cognitive behavioral sort of representational models, a real pivot to how. How are you when you're anxious? So I focused on young adults because that was my experience in the university. And when we do research, it's always good to start to put some boundaries in. So as young adults, I had 2 rounds of data gathering. And I did the first online, in part because we were in COVID and I wasn't sure if we'd be able to do it in person. But then coming out of that, I decided to repeat the experience with an in-person group with a different set of participants. So I had 2 rounds of data gathering. And what I did, having interviewed people individually first, and they all identified as having meaningful experiences of anxiety in their lives. They didn't all have clinical diagnoses. I've tended not to get very excited about people needing diagnoses or having had treatment or because I'm interested in anxiety as the way that young people are using that word to describe their experience rather than the clinical diagnostic term within a medical model. And what we did with each group is I met with them for 1.5 hours, 4 times. And crucially, with some spacing, this was a longitudinal study. It was really important because I wanted them to talk to me about how they were anxious, what they had noticed about their movement experiences, and how the world shows up for them as they moved in those ways in their normal lives, in their everyday life. But talking about movement's really hard. And what came out in the data was sort of how, especially in those first discussions, they almost kind of didn't know what to say about it, which is why the groupness was so helpful. They began to develop a way of talking, in part, of course, scaffolded by my interest and my language and my inquiry. But in hearing about other people talk, it was like a kind of language that became possible, which is a really helpful part of this. So they then took some of that language, took some of those experiences, went back to their lives, and then came back again. So we did this 4 times. And at the end of that sequence, which took sort of 2 months or so, I then left them for 2 or 3 months and then I interviewed them all individually as follow up to see what remained with them of that experience, what they'd gained, what they'd learned. And as I say, the only thing that I was interested in was their embodied experience. So there was no history of anxiety, there was nothing about their thoughts, and there was no theoretical thinking within the discussions, which actually created something really quite spacious. Because if you don't get to kind of make meanings of it, then in joining it up with when my mother was and well, I come from an anxious family and we've all, all the stories that people have about their anxiety, with that set to one side, to just really focus on the experience was surprisingly intimate. And it created a very touching group dynamic, actually, because they're talking about things they don't normally talk about in ways they don't normally talk to each other. So we had these group discussions, and we were pivoting towards how, and all we talked about was how they moved. So I'm just going to show you a few things then. I'm going to stop that for a moment. Um, and just show you now here some of the things that they ended up kind of embodying. So as they were talking about experiences out in their week. Of course, as people talk about how they move, something does come into the room. So there was something live in the movements. Sometimes we encourage people to reproduce something of that movement, and to as when we had especially the in-person group, we would perhaps also take on something of that movement and see what it felt for all of us to move in that particular kind of way. What came out in terms of the findings of this? There was there were two different kind of almost like time orientations to this. What we got interested in was how people experienced anxiety in moments as they were sort of crossing a threshold from one world to another world. So the great way to begin our discussions, of course, was what was it like to come into a group that you haven't met before? Like how was with the experience of coming into this room? What's it like now to be in this room? And so I called this a kind of the crossing of the threshold. And what came out in the discussions was a great range of different ways that together, actually, there was a real kind of common theme in the extent to which there's a kind of quality of um, pushing, was how we came to describe it, a kind of pushing um, against the world. So that might be a pushing of avoiding eye contact. So some people described how as they come into a room, they really don't want to see people because they don't want to see how they are seen. So these kinds of movements of pushing and dropping and kind of gathering back. And then for others, their their sort of embodied style of being anxious was more to kind of come in quite a kind of with force, more of a forceful kind of push, um, and to kind of assert their presence in the room with a really different kind of quality. But for in all the styles, and there were a whole range of different approaches, what became clear was that in anxiety, something that what they were limiting was their receptivity. So in different ways, through movement, we settled together in both groups in slightly with slightly different language sets on this idea that as they moved into a novel situation where they were unsure how they were going to be received or how they were going to manage themselves in that situation, they organized themselves at a movement level to limit and somehow kind of inhibit the way that they notice the world. What became clear was they're actually less open to the experiencing of the world and themselves until something felt more manageable in their engagement. And that was either something about their own effort to be receptive and to listen more, attend more, to be more present, or indeed something shifted in the environment. They noticed something in the environment that was more receptive to them that enabled them to then settle in that lovely kind of intertwining way. Something subtle changes in the environment, and then something in their own experience could settle. So, what we explored in different ways was how they managed the threshold of experience. And then a whole other set of themes was around how people manage the chronic demands of a world that is expecting something of them. Now, I was working with young adults. They weren't all students, but quite a lot of them were. How they manage the relentless demands of academic pressure. They talked about the ways that they noticed themselves in relation to books on the shelf was a really beautiful example from one of my students who described her sense as if the books were kind of looming over her, so kind of experiencing almost like the movement of the books and how that really kind of inhibited her from being able to engage and relate with them because they were sort of asking so much of her at an attentional level or an intellectual level that it was too much. And so that sort of quality of in relation to the books and that tightness. Um, Other people talked about this in a more kind of social way, like what it was to be in the social environment of the university or the workplace or in a pub and how they experience the kind of the pushes and pulls of the world. And again, sort of how they organize themselves to manage effectively to not be so affected by or to affect. And this, I think, I mean, there's lots of chapters in my thesis of doing a conceptual review of the literature on anxiety. But I'm just going to I'll go back to sharing my screen. Oh, am I still sharing my screen? Ah, I thought I wasn't. Sorry.
You were sharing your skin,
I
yes.
was hoping that more of my movements would be clearer. Okay. Right. So, but the findings on anxiety, the overarching theme really was how they were managing their affectedness in the situation. So both how they are affected, and but also managing and regulating how they affect the environment. So in effect, it was really about how they experienced or were trying, in fact, to achieve a sense of separation. Now, as good little phenomenologists, we would know we're never separate. and we're always already immersed. Um, but it's experientially that in anxiety, it does seem to be that a major function of it is about how to get a little bit of separation from this world, however it is being experienced, whatever the affordances are in the moment. So, this language of pushing, pushing against, pushing on, and how this limited their receptivity. If we limit our receptivity, we won't be as moved for sure, and that may be absolutely appropriate and supportive. But if that has become a habitual experience, and as a psychotherapist, that's always what I'm interested in, what's become the pattern, what's become the kind of default way of being in the world, if this limiting of how much we are moved by the world has indeed become habitual, then it is harder to notice how the world, what possibilities might actually be there, because we're already shaping ourselves in such a way that the world will show up to us in that way that we are expecting. So what we played with within these discussions was the ways that they may indeed be may change their receptivity and experience the world as more or less available. But I do want to say this was not a psychotherapy intervention. I was really clear with all my participants that I was not intending to fix or change their anxiety, but rather just to learn something about it. What then became sort of fascinating, of course, is how, in a way, quite therapeutic that was. I mean, it's such an interesting thing for me as a practitioner, moving into a researcher role. I was quite liberated actually in not feeling like I needed to do something to fix this, right? So actually, me not having to be in a role with them enabled me to be more curious, although also I have to say more moved. I think there was something profoundly affecting at times about hearing about their distress when I wasn't in a therapist position, and I had a kind of a thing that I could do to try to alleviate it. Actually, just to sit with it and have a curiosity about their experience, it did feel a bit different. However, what did it do for them? I wasn't trying to fix it. What they got out of it, and it came out so clearly at follow-up, they came to understand that their anxiety had a function. So it was not a how they are in a situation. I just missed out a word there. They It was not that they were anxious because of something inside them. Rather that it was actually how they were in the situation. And particularly, I think, because of this attention to movement, it did afford them to recognize this is contextual, this is really situated. So it completely shook this idea of I have anxiety in a kind of global, enduring kind of way, because they could see, well, I was anxious in that situation, and then I went into that situation and I wasn't anxious. And they could feel the difference. And so, what it really enabled was a kind of less individualizing and less pathologizing position. They became more curious in their experience and for others. I mean, I had a strong sense as I was designing this research that doing it in a group would be really helpful because it's quite a novel thing to talk about movement. But what became much clearer to me through this was the sort of the interpersonal scaffolding, like to have a group of people who are really listening itself deepens your attention to your process, as well as the kind of handing over, it's very kind of Vygotsky and the very kind of handing over of words to make sense of things. So more curiosity in themselves and in others, and their anxiety as they understood its function seemed for the most part. So I had 6 people more or less in each group, with the exception of one, I would say they found their anxiety more acceptable and less distressing at the end of this intervention. In part, I think, because they trusted their experience, they trusted it had a function, which is something I do find really problematic about the cognitive behavioral sort of models, where the implication that you have disproportionate or inappropriate beliefs about the world that are making you anxious, I think can lead to a kind of distrusting of experience. And I think what happens in this kind of a phenomenological inquiry is they had more trust in their experience. And so this lovely quote from one of my participants was echoed in similar language by many when they said 3 months afterwards, on some level, nothing has changed, right? They still experienced anxiety. Um, I mean, sort of, yes, of course, four group discussions isn't going to shift habitual patterns, but also these are normal experiences. So they were very clear in saying, yeah, I still get anxious. So at some level, nothing has changed through these discussions. But on another level, everything has changed. So in coming to see and feel at a deep level and to have an ongoing curiosity, they all had vignettes at follow up of how they had used an attention to the way that they were moving and the way that they were being in the world in the weeks prior to the follow-up interview, that had been a support in managing a particularly difficult experience. And I would say overall that they began to see themselves as sense-making beings, making more sense to themselves, which I think is a fantastic outcome. Even though, there was a moment as I began to realize that this had still left my participants feeling anxious, I have to say I was a bit disappointed. There was a bit of, oh, I sort of thought this was going to really shift something, but actually it shifted something much more profound. So I think it's been a much more interesting finding in the end. Um, but let me say something then about how I've been weaving some of these findings into a model of sense making. I want to build on the work of folks here. But first of all, I just want to say something about the different qualities of self experience. So um, we are, I've been thinking a lot about what it is to be aware of oneself moving. Now, we are all have, if we're living and breathing and if we're moving around in the world, we must have some, this is what Typele would call a kind of primal self awareness. There is, if I'm going to walk out of this study and go out into the garden, I must be aware of something, even if I'm thinking about what I'm going to have for tea. There's clearly some awareness of something going on. It's just outside my active attention. So there's always a primal self-awareness across all states. Then I'm using this term generated awareness because either prompted by something outside or inside, we can then become more aware of ourselves. So I could be walking out to the garden and thinking about what to make for tea, and I can hear a bird sing, and then I become more aware of, oh yeah, the garden door's open, and I notice something about the garden, da 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 da. So something might come in that brings something into my awareness. And this is happening at the level of what Fuchs and Koch were calling either the bodily resonance, which is our kind of our sensing of something, and the bodily feedback, the kind of sense we make of that. So either from outside or from inside, we may become more aware of ourselves, even where there's no concepts. Then, of course, we do use our language, our concepts, our experience to clarify something about what that is. So, if I walk on ice, my first thing might be the slippiness, but I'll be using something of, oh, this ice is slippy, and then I will move in a way because I've had all the experience of what it is to walk on ice before, and I'll use my experience and the concepts of walking on ice to organize how I walk. So these the way that we use language and concepts and even putting words to experience, calling something wobbly or calling something hard or firm, might make something clearer to us. I always like the example here of something like wine tasting. You know, if you ever go to a wine tasting thing and someone says, "Oh, it tastes like cherries," you're like, "Oh," and it does change the way you taste the wine when someone has given you the word cherry. So our use of language and concepts does interact with actually then what we sense. Um, and that's adding another kind of state. So there's a state where we only have primal awareness. There's a state where we notice something. There's a state where we are using our concepts to clarify that. And then there's a state where we're making sense of that. And clearly, what's happening in some place, in some moments like anxiety, is that we're making a sense of our experience without actually feeling much. So, this is where we've got a story about how the world is, but we've not actually checked out what the actual feeling is. And I think that sometimes when people are in that I have anxiety, what they're not noticing at all is what it is like. So I see the work of this thesis as being about, well, what happens in anxiety then if we actually really generate more awareness and we put language and sensation to this experience? So Fuchs and Koch had this model. This is in their 2014 paper on moving and being moved. This is their first schematic was on embodied affectivity. And I found this model super helpful when I came across it about 10 years ago. That as here we are, the self is always already immersed in the world. We are affected, we are moved and get an impression of the world. As it lands on us as a subject, we both resonate, you know, something happens at a sensing level, and we make sense of that through the feedback it gives us in our bodies. And as we make sense of that, so then we move and express, we kind of emote, and that is then, you know, expressed back towards the environment. So that was their first schematic, and I'm just added on to there to emphasize that I see this as having these two sides of what it is to sense something and what it is to make sense of it. And then they build that up into this intersubjective model, they call it interbodily resonance, where we've got two people, and it's about how the resonance, how the expression of the other lands on, and the truly intersubjective experience that's so familiar to me from my psychotherapeutic experience of how we are moved by the experience of the other, and how we are not only moved in a sensate level, but we're making sense of that. And I think this underpins a huge part of the psychotherapeutic process. So let me move, sorry, quickly down. So when I think about, you know, adapting and making sense of my findings in a model like this, rather than use the two arrows going between self and the world, I really like the lemniscate. I like this idea of that we're in a complex, micro moment by micro moment interaction with the other. As I subtly move in the therapy room, I'm already moving my client. So the lemniscate is our complex intertwining. I then reorient the diagram. So rather than have self and the world on different sides, I would put self experience here within this oval, and the other person, the other world situation, all the levels at which the other, the outsideness of the self within this box. So there's just starting here with where there's just primal self-awareness. There's some kind of bodily resonating, there's some bodily feedback. And this is always the resonance is in a complex intertwining with the world, and the way that we make sense of that is in a complex intertwining with the world. And then when we start to add in our generated awareness, this is how we use language and how we draw attention, the quality of attention, how we how this again is sitting within this model where these are in complex intertwinings with the world outside us. And this is the world of my intervention. You know, it was the presence, it was the quality of our receptivity as a group, my inquiries, and the whole group's attention, as well as the words and the sense making that we're offering back, that really deepened the awareness that our individuals had of their experience. And I think that when parenting or therapy or all these other interpersonally scaffolding situations is going well, this is what's happening, is that we are resonating and we're receiving support for our sense making from the environment. So how do I see anxiety within this? Well, I think something that's missing from that Fuchs and Koch kind of schematic, again, just having self and world on the one side, is it is in their model as if the self is completely open. And I think if we bring in the concept of autopoiesis from enactive models, where the model of the self is such that it is managing, trying to maintain a sense of integrity. Yes, the organism is always immersed in the world, but it's also trying to manage its openness to the world. And I find that that concept of autopoiesis is so helpful as we um, begin to think about a more, I think for me, a more helpful conceptualization of anxiety, because it seems to me that this way that the self is trying to maintain its integrity, managing its openness. If I superimpose this now onto my diagram, I think this is really what we were exploring in our groups, is that the function of anxiety is how we are trying to create a kind of boundary, it's an experiential boundary, to manage the integrity of the self's experience in the world, and that that is operating both at the level of sensing, at the kind of perceptual level of what we can take in of the world, but also in the qualities of our sense making, that we can have a kind of a resistance to making new sense of the situation. I think if any of you have been around people who have very extreme episodes of anxiety, you'll know in that moment they're quite out of reach. There's a real holding on to their view of how the world is in that moment that is happening not just at a sensate level, but it's at a sense making level. So, I'm going to draw this to a close in a moment. I think what's this work been doing then? Well, it certainly, I think, provides a challenge to this representational model of anxiety, which I find so problematic in our health services at present in the UK, certainly. They tend to conceptualize anxiety as either chronic fear or an intolerance of uncertainty. And my concern with that model is that how if we associate anxiety too closely with fear, sometimes it is fear, right? Sometimes what people are describing when they say they're anxious is fear, but that's okay because we've got a really good word for that. It's fear. Let's try and perhaps separate and distinguish that anxiety can actually be a much broader phenomenon. So I think this challenges that, because I think it's proposing that there's this managing affectivity is just as important and just as frequent an experience. And actually, then, if we've got a better conceptualization of it, I think it does clarify this distinction between what it is to be anxious and to be distressed about about being anxious. And that's what came out clearly in my follow-up. That for my participants, where they felt validated, where they understood their experience, and indeed felt more of their subjectivity in it, then when they were anxious, it was just another experience. It was just how they were, as they tried to navigate that moment in their lives. And that became less distressing. Um, it just becomes another way of being. And it already, I think, then anticipates places where we cannot be anxious if we have this looser. And for some, I think that this kind of an embodied relational approach can really help. These were quite short interventions and they seem to have, they weren't intended to be therapeutic and yet they sort of were. So I think there's all sorts of interesting possibilities here. Um, and crucially, that this need not be in the context of long-term individual psychotherapies. I do wonder about the extent to which my profession is also part of the whipping up of pathologizing of states and the idea that individuals need to go off into little rooms one on one to understand their pathology is I mean, I am a therapist and I love that work. And there are tremendous gains for people who need that level of insight and that quality of holding. But what this really brought to the fore for me is getting young adults together in groups and without talking about their stories about their anxiety and making sense of it in terms of their histories, just that pivot to the how already seemed to be offering something which I think is a very hopeful possibility as I consider intervention development. I think there are some cultural implications of this model as well too, which I'm just going to have one moment on before I wrap up here, and I'm really interested in your thoughts and questions. Um, I think it's really helpful to have a model that more explicitly links anxiety with being overwhelmed. I think that, I'm the mother of three young sons. I am staggered every time they open their phones, what a volume of notifications and things is hitting them in their world. The volume of possibilities, the digital arena is, I think, offering overwhelm at so many levels, not just the sensory. So I think something that links states of anxiety with how we are managing our openness to the situation is important. Um, I also think, crucially, that to the extent that when we are anxious, we're not as open to the other, a model that starts to think about, well, what are the implications when people are anxious in terms of their intolerance or objectification of the other. And my God, in this global world at the moment, anything that overcomes that or challenges or opens up possibilities for us to be more open to being affected by the plight of the other and how we might offer people support to be more affected and to not feel that they have to close down their experience feels politically irrelevant too. Um, but it does crucially, I mean, under, the whole kind of theme of this really is that I think this emphasizes the importance of our fully embodied sense making. So it's a real contrast to the flatness and the objectifying quality of a lot of our digital encounters. What we had in our interventions was a capacity for resonating with each other. We had time for each other, and especially the one that was in person, which did seem to kind of go a bit further than our online intervention. This is about how do we give time and attention, and I think that that's not just about in our therapeutic processes, it's also in our parenting, it's in our schools, it's in our workplaces. Our sensing and our making sense of our sensing needs to be interpersonally scaffolded. That really came through in the facilitation. They could not have done this with a workbook. This needs living, breathing beings to live and breathe and share their interest and their curiosity and to hand over language to facilitate something metaphoric, so that they become more sense-making beings to themselves. So I'm going to draw that to a close now. Oh, a few minutes over. Sorry, I have gone over on time because I do really want to hear your questions. Let me pause there. Thank you.